Let's pull this together. Landon often comes to school with no breakfast, so he's hungry. Not a good way to start the day. He does fairly well until about an hour before lunchtime. The teacher says that about that time, Landon will try to grab food from the snack shelf. The teacher usually physically redirects Landon to another area of the room. She reports that it doesn't help, and Landon keeps going back to the shelf. Landon does not go to the snack shelf after lunch. So there's some information that we can use that I just read to you. So let's pull this apart. Typically, the teacher or consultant will have collected data over several days. They have determined the antecedents to the behavior include the fact that Landon had no breakfast, which is a setting event. The trigger was more difficult to identify and is probably an internal signal that he is hungry. The behavior has been well described. Landon tries to grab food from the snack shelf. The consequence is the teacher directs Landon away from the snack shelf. This may not be enough information to develop a hypothesis for the function of the behavior, but the teacher and the consultant also looked at when the behavior did not occur. After lunch, Landon does just fine. That is the data that supported the function of the behavior, which is obtaining food. Now we are going to talk about interventions throughout this workshop, but let's think a little about what we might do now that we have a good idea of the function of the behavior. The easiest thing to do would be to provide a snack about an hour before lunch. This beats redirecting him over and over. We could go to a step farther and teach Landon to ask for a snack when he's feeling hungry. Asking for that snack is the alternative behavior that meets the same function as the problem behavior. The next slide will show you how to complete an ABC chart for this behavior. The teacher and the consultant probably kept an ABC chart going, showing multiple incidences of the behavior, so they had enough data to support their hypothesis.